Woman of Reddit, what's your worst experience with a medical professional who dismissed you just because you're a woman? I had a C-section in June. I popped a stitch or two in the shower and my incision ripped halfway opened. My doctor came in the next morning with plans to discharge me. I tried explaining to him that my incision was ripped open and he insisted that it was normal for that to happen sometimes. My husband had to jump in and my doctor finally took it serious. This doctor also delivered my youngest a month early, without my full consent when I felt like she could have baked in me for a little bit longer. Thankfully I'm done having children so I won't have to deal with seeing him anymore. My sister is 23 with lifelong debilitating symptoms that keep her from working or driving and all tests that are run show normal. When she got a new symptom, seeing visual flashes of light that totally block out her vision, she tried a new doctor. After running no tests, he insisted that it's in her head and she needs to have a healthier lifestyle. My sister asked what she's supposed to do when she's constantly fainting and losing vision. He wrote her a note for her to get glasses. Even the eye doctor was astounded. At 20 or so I had quite a large lump in my breast. I was sent in for a number of tests: mammogram, sonogram, biopsy. First, the doc doing the sonogram was mumbling things along the lines "this does not look good," which did not do wonders to my state of mind. Along comes biopsy doc, male, 50s or so. He tells me the biopsy doesn't hurt at all. Well, it turns out having a large needle shoved into your breast without any local anesthesia actually does hurt. A lot. I wanted to kick his nuts and tell him it doesn't hurt. You'll need to work on fainting when you get in or you'll never be able to handle pregnancy. I was 12. I was in the ER and had just been diagnosed with vasovagal syncope, which is when your heart, blood pressure and nervous system malfunction. I'm not scared of needles, it's just an automatic and unconscious response. I passed out mid-joke. This was also after I told them to get an experienced phlebotomist and they had the nursing students stick me and move it around. Not the worst, but the most consistent is the ER pregnancy test. For the men they will withhold treatment, other testing, and pretty much every form of care until they get their precious pregnancy test done. I'm not pregnant. In fact, it would be impossible for me to be pregnant. It would also be impossible for the current emergency I am experiencing to be caused by pregnancy. And yet, I will be denied care unless I consent to an unnecessary, expensive test. For 5 years I had blood in the urine in urgency. A handful of doctors just shrugged, assuming I have a vagina that bleeds, ergo urine blood. They assumed because I'm sexually active it must be a UTI. Used birth control to skip periods. Still urine in the blood. They still tried to blame my period. They tried to blame UTI even when no bacteria was found. Finally got an ultrasound. Turns out I've been passing kidney stones the whole time. They say the worst pain for men is when a gonad twists. My right ovary went through 3 complete rotations while no doctor at 2 different hospitals took my reports of pain seriously enough to run a standard diagnostic test. By the time they finally diagnosed it after 5 days of runaround, the organ was dead and needed to come out in emergency surgery. If it had gone untreated much longer I wouldn't have survived. Generally the pain of gynecological investigative procedures not being taken seriously. Having a medical instrument holding open your cervix is incredibly painful and the advice to take paracetamol 20 minutes beforehand as some discomfort may be felt really doesn't cut it. Sedation, general anesthetic or serious painkillers are required and, certainly when I was going through this, none of these were given on the NHS. I was 19 and broke out in a rash. I was pretty sure it was chicken pox. Not wanting to infect anyone, I let the DRS office know when I made my appointment so they could take the necessary precautions. Got there and this make doctor came in, quickly examined me and started walking out the door. I stopped him and asked him if it was indeed chicken pox. He told me to go home and ask my mother. BTW. It was chicken pox. I bled menstrual for 10 months straight and got put on 3 different kinds of birth control within a 3-month period and had suicidal thoughts and they told me I was just constipated. Went off the birth control, stopped bleeding and stopped having suicidal thoughts. The kicker is, I'm a fucking medical professional. He still told me I was confusing my cramps with constipation. I was experiencing breast pain so I went to get checked out. After a scan I was told there was no visible issue grade and that it was probably a side effect of birth control not great. When I asked the doctor if I was just going to have to live with it he said, well, you're getting on a bit. You should think about coming off birth control anyway. Reader, I was 27, probably the creep who told me when I was 18 that I didn't need birth control. because if I was raped I should call the police anyway. Setting aside the fact that I wanted birth control so I could safely have sex with my boyfriend, what were the police going to do to prevent pregnancy? Shoot me in the abdomen. A male GP once said something along the line, "It's not fair for me to give you a sick leave because of your dysmenorrhea." I couldn't walk upright that day from the terrible period cramp, let alone concentrating getting work done in office. What's truly unfair is that men's testicles don't get cramps. I got diagnosed with PCOS at 16 and sent to my very first ever obgyn. They looked me in my face and told me I'm way too fat and that I caused my PCOS because of that. I was under 200 pounds at that time. Bigger for my age, but definitely not way too fat like I was led to believe. I told my male gynecologist my mom also had him, which I now realize is weird. That I bleed during sex sometimes, and he said, "Are you in a committed relationship?" Right now I am. Good. Then just get him into a little foreplay, you're young, you'll be fine. Male doctor in ER I went in due to the worst headache of my life. He was annoyed at doing a migraine workup despite the fact that I said I'd had an untreated aneurysm. Turned out I was an active brain bleed. I was disoriented and incoherent within an hour. I was 18 and had pain when trying to have sex or undergoing vaginal exams. The gynecologist I had then said one day, "Don't go making a fuss," and referred me to a gynecologist surgeon, who had to perform a hymenectomy on me. I stayed at the second GYN. When my doctor told me I couldn't be in labor because he had checked hours before, things don't progress like that, and I would need a C-section in the morning. I told him to check again. I was 5 centimeters dilated. 3 different doctors told me about my heavy bleeding. I ended up hospitalized needing blood transfusions that, in someone my age, it was probably nothing. Nothing turned out to be endometrial cancer. I have recurring tendinitis in both wrists, sometimes so severe I can't even hold a fork or a pin. The doctor told me to just deal with it. Girls have a good pain tolerance. I was like 19-20, asking if my husband was okay with me getting my tubes tied. Yeah, he was, but it wasn't his decision to make. 3 kids in 5 years, all birth control fails. I asked for them to be destroyed. Missed a shattered L5 vertebrae, calling it a muscle sprain, because he obviously didn't have the time to look at a fat, middle-aged woman's x-ray. You know what whiny liars we are. A male doctor dismissed my suicidal thoughts as just being on my period. I wasn't on my period, but even if I was, alarm bells should have still been going off in his head. Men or women, gynecologists seem to only know one solution to pain, and if that doesn't help, they shrug and move on. I still continue work 3 days a month of the pain. You don't have PCOS, you just need to lose weight. Your infertility isn't from PCOS, you just need to lose weight. 5 doctors and a decade later, PCOS diagnosis. I told my doctor my new medicine was making my skin burn, and I asked if this was a normal reaction, and he responded, "I don't know, I'm not a psychologist." Dismissed my symptoms for 2 years. I had cancer. If he had listened to me I would have been stage 1. Instead it got really bad and I fought it at stage 3C. Bro, okay, so I'm not a woman but I have long hair and a groin pain, and I went to an unfamiliar doctor and he said to me, "You're probably just on your period." So, the fact that there are any replies whatsoever here, is concerning. Reading the replies made me lose a grain of trust in humanity I still had left. For years and years when I'd brought up the fact I've never had an orgasm, could there be something wrong with me, I always keep trying. Being told just spend more time with foreplay by a medical professional after going on medications that kill libido. Tummy ache and diarrhea, been over double pooping blood, was told it's women's problems. Reality, I had a perforated ulcer. A doctor wouldn't agree to do a C-section, another female doctor had recommended until my husband intervened.